All right, guys, this is Coach Schneider presenting you with a screencast on non-communicable diseases for the quiz tomorrow. I developed a Prezi that has the information on it, and I'm going to go through this so you guys can have a quick review, and hopefully tomorrow you can do well on the quiz. Okay? Non-communicable diseases, or the big three. Non-communicable diseases, the definition is a disease that is not transmitted by another person, a vector, or environment, which means these are diseases that cannot be passed from person to person, or you cannot get from, say, the environment. So moving on. Number one of the big three is cardiovascular disease, or CVD. The definition is cardiovascular disease, a disease that affects the heart or blood vessels. Several things to know about cardiovascular disease. Number one, cardiovascular disease is the number one killer in the United States. Second, the risk factors of cardiovascular disease are tobacco use, high blood pressure, high cholesterol, lack of exercise, overweight, stress, and alcohol and drug use. One thing that we didn't talk about the other day that's important to know is that men have a greater risk to develop cardiovascular disease, and that the risk of cardiovascular disease increases the older you get. The second of the big three in non-communicable diseases is cancer. The definition for cancer is here: the uncontrollable growth of abnormal cells. Okay? And with cancer, sometimes you have a term called tumors. A tumor is an abnormal mass of tissue that has no natural role in the body. Now, tumors can be one of two things. The first is benign. A benign tumor is non-cancerous tumor that grows slowly. Okay? So if you have a tumor and it comes back and they say that it's benign, that's good because it doesn't have cancer. Now, it could also be bad because it could hinder your body and how it functions, so doctors may want to remove it. The second type of tumor is this term here, malignant. A malignant tumor is a cancerous tumor that does not stay in one place, and that's what makes cancer harmful, is that it affects one place and then it moves and spreads to different parts of your body. Lymphomas, these four here are four different types of cancers. The four main types. Lymphoma is a cancer that affects your immune system or your lymph system. The second type of cancer is leukemia. Most of you have heard of that type before. Leukemia is a cancer that affects the blood-forming organs of the body and also the blood. The next type is carcinoma. A carcinoma is the most frequent type of cancer that is found, and that's found in the glands, organs, and the skin. And then the last type of cancer that we talked about is sarcoma. Sarcoma is found in the connective tissue of the body, in bones, ligaments, and muscle. The last of the big three in non-communicable diseases is diabetes, which we talked about yesterday. The definition of diabetes is a disease of the endocrine system that affects the way body cells convert sugar to energy. So basically, diabetes affects the amount of sugar that's in our blood. There are two types. Type 1 diabetes cannot be cured. If a person has type 1, they will be infected they have it, they need to live with it. In a type 1 diabetic, the body does not produce insulin, and they need the insulin from a different source. You can give yourself injections, or you can also have an insulin pump, which pumps in insulin throughout the day through a tube that's located into their abdomen. And again, a type 1 diabetic will have it their whole life. Type 2 diabetic is a different type. It's the same disease, but it affects people differently. A type 2 diabetic can be cured. In a type 2 diabetic, the body produces insulin in the pancreas, but it's unable to use it effectively based on weight, diet, things that they eat, and not getting much exercise. The thing with type 2 diabetes is that it's developed over time. And the things that lead it to type 2 diabetes is a lack of exercise, poor diet, and it's found in people who are obese. The good news about type 2 diabetes is that you can be cured of it, and what causes it, the lack of exercise, poor diet, and being obese, is also the thing that can fix it. You can start to get exercise, you can start to eat right, and by doing that you will lose weight. So those are the main points for tomorrow's quiz over the big three of non-communicable diseases. Hopefully you found this helpful, and I'll see you guys tomorrow, and good luck on the quiz.